Nutrition, 5th edition, Chapter 16, The Life Cycle, Maternal and Infant Nutrition by Carrie Erickson. Pregnancy. Nutrition before conception. Nutritional status before pregnancy is an important part of having a healthy baby. Moreover, it is an integral part of all aspects of preconception care. Risk assessment, health promotion, and intervention. Being either overweight or underweight prior to pregnancy increases the risk of complications. Weight. Maintain a healthy weight. Vitamins. Folic acid supplementation before pregnancy has been shown to reduce the risk of neural tube defects such as spina bifida. Substance abuse. Excessive intake of some vitamins, vitamin A in particular, tobacco, alcohol, and drugs increase the risk of poor pregnancy outcomes. Women should discontinue these practices before they become pregnant. The physiology of pregnancy. Stages of human fetal growth. Pregnancy can be divided into 3 stages: blastogenic, embryonic, and fetal. In the blastogenic stage, the fertilized ovum begins rapid cell division and implants itself in the uterine wall. During the embryonic stage, organ systems and other body structures form. During the fetal stage, which is the longest period of pregnancy, the fetus grows in size and changes in proportion. The physiology of pregnancy. Maternal changes. Hormones released throughout pregnancy influence the growth of the baby and alter the way the mother's organs function. And you can see this picture that shows blood volume increases, the uterus expands, heart rate increases, fat stores increase, and the GI motility slows down. Maternal weight gain. Women who enter pregnancy at a normal BMI should gain 25 to 35 pounds during pregnancy. Underweight women should gain more weight, usually around 35 to 45 pounds, and overweight women less weight, around 15 to 25 pounds. Energy and nutrition during pregnancy. Also, nutrients to support pregnancy. You need macronutrients, which includes protein, fats, and carbohydrates. Energy and nutrition during pregnancy. A pregnant woman requires added calories to grow and maintain not just her developing fetus, but also its support system, the placenta, the increased breast tissue, and the fat stores. Growth and development of the fetus also requires protein, vitamins, and minerals. Needs for vitamin and minerals increase during pregnancy, some more than others. Extra vitamins and minerals are needed to support growth and development as well as increase energy use. Recommended intake levels increase most dramatically for folate and for iron. With the exception of iron and folate, a well-balanced, varied diet can often meet all of the pregnant woman's nutritional needs. Pregnant women should choose nutrient-dense and high-carbohydrate foods in proportions found in My Plate. Although vitamin and mineral supplementation is common during pregnancy, it probably is not needed other than for iron and folate. When supplements are used, they should be designed for pregnant women. Pregnant women should avoid alcohol and moderate their intake of caffeine. As far as substance use in pregnancy, limiting caffeine during pregnancy is recommended. Smoking during pregnancy increases the risk of preterm delivery and low birth weight. Alcohol and drug use can interfere with normal fetal development and should be avoided during pregnancy. Special situations during pregnancy. Gastrointestinal distress, such as morning sickness, heartburn, and constipation, are common during pregnancy and result from the action of various hormones on the GI tract. Although most food cravings or aversions present no problems, excessive consumption of non-food items, known as pica, interferes with adequate nutrition. So sometimes women will have cravings for strange things, such as laundry soap, cigarette ashes. This is what's known as pica. And this is something that they should mention to their doctor because their body might be lacking in some other area. Food cravings and aversions. Hypertension is a concern when not accompanied by other symptoms. Increased blood pressure during pregnancy is usually temporary and carries little risk. However, the combination of hypertension and proteinuria, which is protein in the urine, indicates a serious medical condition called preeclampsia. If preeclampsia progresses to eclampsia, it can threaten the lives of both mother and baby. There's also diabetes and gestational diabetes. Gestational diabetes is a condition in which abnormal glucose tolerance exists only during pregnancy and resolves after pregnancy. HIV/AIDS, and also adolescents. Pregnant adolescents are nutritionally at risk. Their own needs for growth and development are compromised by the extra demands posed by the growth and development of the fetus. They have more of a risk for preeclampsia, anemia, premature birth, low birth weight, infant mortality, and sexually transmitted diseases. These are all increased for pregnant adolescents under the age of 16. Lactation. The physiology of lactation. During pregnancy, hormones control the development of breast tissue in preparation for milk production. Colostrum, the first milk, which is rich in protein and antibodies, is produced soon after delivery. By 2 to 3 weeks after delivery, lactation is well established and mature milk is being produced. The physiology of lactation. Basically, they're talking about the pituitary hormone prolactin stimulates milk production. Oxytocin, another pituitary hormone, stimulates milk release, which is known as the letdown reflex. Nutrition for breastfeeding women. Choosing a variety of foods from the MyPlate daily food pattern for pregnancy and breastfeeding is the best way to meet the nutritional demands for lactation. Following the food intake patterns of the MyPlate daily food plan for pregnancy and breastfeeding, diets of 2,000 to 2,800 calories a day can easily meet most nutrient needs. Cigarette, alcohol, and illicit drugs should not be used while breastfeeding. Energy, protein needs are usually higher than when pregnant. Vitamins and minerals, most of the are higher or the same as during pregnancy. The iron and folate needs are actually lower. And it's important to drink water, and as once again, those food choices are always so important. As far as supplementation with lactation, some breastfeeding women need routine vitamin mineral supplementation. This should include those women who do not follow dietary guidelines and vegan women who avoid all animal products. So a lot of times during lactation, it's still important to take your prenatal vitamins. There again, you want to make sure you're avoiding alcohol, drugs, smoking, and excess caffeine. The benefits of breastfeeding. Infants receive optimal nutrition from human milk. Breastfeeding can reduce the incidence of infectious disease, allergies, and other problems during pregnancy. Some of the benefits for the mother. Mothers benefit from breastfeeding through enhanced physiological recovery. convenience, and emotional bonding. Some contraindications to breastfeeding include infections with HIV or active tuberculosis and regular use of certain medications. So for them women, usually breastfeeding is not an option for them. Resources for pregnant and lactating women. There is agencies and education programs. The La Leche League, the March of Dimes, and the WIC program for low-income women are among numerous resources for support and education of pregnant and breastfeeding women. Next, we're going to talk about infancy. Infant growth and development. Infancy is the fastest growth stage in the life cycle. Infants double their birth weight in 4 to 6 months and triple it by 1 year of age. The nutritional status for infants is assessed primarily through measurements of growth. And here they're actually talking the weight gain, the length gain. They increase their length by 50% by 12 months, and head circumference is always measured with infancy. The growth is the best marker of nutritional status. They are usually evaluated by using growth charts, and here again it mentions that weight gain is doubled by 4 to 6 months, tripled by 12 months. Okay, energy and nutrient needs of infants. Infants' energy needs must be met through a high-fat diet, which includes the maximum calories in minimal volume. Infants' protein and fluids needs are also high. Their energy is the highest needs of any life stage. Protein is also the highest needs of any life stage, and the carbohydrate and fat is the major energy source. The key vitamins and minerals for an infant. Infants who lack sun exposure can become deficient in vitamin D. A dose of vitamin K usually is given to babies at birth to ensure a sufficient supply. Because vegan mothers can have breast milk deficiencies in vitamin B12, their babies may need a B12 supplement. By the age of 6 months, breastfed infants need additional iron. Formula-fed infants should consume iron-fortified formula. Human milk is low in fluoride. Newborn breastfeeding. Human milk is low in vitamin D. Breastfed babies, once again, if they aren't exposed to the sun, just a few minutes a day, they may need a vitamin D supplement. There are alternative formula feedings. Infant formulas usually are based on either cow's milk or soy protein. Unmodified cow's milk is inappropriate for infants through the first year of life. The FDA regulates the vitamin and mineral composition of infant formulas to ensure they provide adequate infant nutrition. Formula is available in ready-to-feed, liquid concentrate, and also powder. This will wrap up part 1 of chapter 16. Be sure to listen to part 2.